So hello everyone and welcome to this new session. Now this YouTube session is on the neuroanatomy MCQs. Yesterday we discussed head neck. Today we are going to discuss the neuroanatomy MCQs. I'm Dr. Ankit, anatomy educator, MBBS MS Anatomy in our Unacademy platform. Let us see some slides over here. The NEET PG vitals have already been published, so you can have a look at them. They're all the recorded videos for the comprehensive preparation. Next, we have this last sleep marathon, which is already started on 22nd of Jan. Next, we have this for the FNBU students. We have this batch that's going to start on Monday, Feb 6th, and this is of 4-month duration. Republic Day, so there's still 1 day left till January 28th. You can get up to 20% off. There's a new price list. Code, which I told you yesterday also, Dr. Ankit Khan is the code that you can use. If you want to avail some offers. Right, so let's start with the neuroanatomy MCQs and let's discuss few MCQs and without wasting too much time. 78-year-old man complains to his physician that his face feels funny. Examination reveals numbness on his face and on the same side of the tongue. So face feeling funny, numbness looks like sensory involvement. MRI shows a lesion in the cerebral cortex. This man's lesion is most likely located in which of the following cortical regions? So we have the sensory involvement of the face and lesion is in the cerebrum, in the brain. What do you think is the answer? Anterior paracentral, lateral 1/3 post, lateral 1/3 pre, or middle 1/3 of post central. Let us see this question. We all know about the brain structure. You have a central sulcus. Suppose we are looking at a lateral surface of the brain. You have a central sulcus. Anterior to it, you have the precentral gyrus, and posterior, you have the post-central gyrus. Remember over here, this precentral gyrus is for the motor area. The post-central are for the sensory area. Brodmann's 312 for sensory. Problem number 4 for the primary motor area. Now, therefore, the face is feeling funny. That is why some sensory involvement must be in the post-central gyrus. One thing is that clear. But post-central gyrus involves the whole body. How is the body distributed? Remember, body is distributed upside down. When the head and neck are located on the lower lateral part, the trunk and upper limbs are in the middle part, and the lower limb is in the upper part, which goes slightly to the medial surface of the brain as well. So here in the question, they said about the face in the lower lateral part of the post-central gyrus. If you look at the options, post-central have these two options, B and D. Lateral 1/3 B and D. So answer is our option number B, lateral 1/3 of the post-central gyrus. Right? Let us see the next question. 67-year-old man complains to his family physician of severe headaches. The examination reveals visual deficits in both eyes, and MRI shows a lesion in the cerebral cortex. So there is visual deficit in both the eyes, and MRI shows again a lesion in the cerebral cortex. Which of the following cortical structures represents the most likely location of this lesion? They are indirectly asking you that do we know or do you know the areas in the brain which have connections with the visual pathway? That is the whole question. Options are angular gyrus, cingulate gyrus, lingual and parahippocampal gyrus. What's the answer over here? We all should be knowing, or we all probably know, that visual area is located in the occipital lobe with the Brodmann's number 17, 18, 19. But which is the gyrus over there? Gyrus over there in these options is the lingual gyrus. Option number C is the answer. Lingual gyrus, the calcarine sulcus and all that, they are located in the occipital lobe. Lingual gyrus is the answer. If we look at the other options, angular gyrus is present in the parietal lobe. Remember, angular gyrus with the Wernicke's complex. Cingulate gyrus is just over the corpus callosum on the medial surface, part of the limbic cortex. Parahippocampal gyrus again below and medial to the temporal lobe, again part of the limbic cortex. Answer for over here will be our lingual gyrus. Clear? So lingual gyrus is located somewhat over here on the medial aspect, more on the medial surface, right? That is the location of the lingual gyrus. Let us see one more. Sagittal MRI of a 29-year-old woman is located at or immediately adjacent to the midline. At or immediately adjacent to the midline, which of the following spaces or structures would be in the image and would indicate a midline plane? They are asking you that out of these five options, which is indicating a midline plane, presence of which structure in this MRI would indicate that this particular slide is taken up exactly at the midline or very close to the midline. That is the question. Options over here: aqueduct, corpus callosum, interpeduncular fossa, interventricular foramen, or superior colliculus. Let us see each one by one. Cerebral aqueduct, we all know that it connects the third ventricle to the fourth ventricle, and it is a cavity in the midbrain. How many cerebral aqueduct are there? Only one. Is it in the midline? Yes. Is it very big? No. The size is very small, hardly a millimeter or two. It looks like a probable candidate for the answer. Corpus callosum, we all know, is a commissure fibers connecting the two cerebral hemispheres. Is it very thin, very small? No, it is quite huge, and it is connecting the two cerebral hemispheres. So the presence of corpus callosum does not indicate it is always midline. It can be midline, but it can be paramedian also. Again, interpeduncular fossa is a broad space between the two cerebral peduncles. Interventricular foramen, that is foramen of Monro, they are connecting the lateral ventricle to the third ventricle. But how many lateral ventricles are there? Two. So there are two interventricular foramens. Are they close to midline? Yes. But are they exactly in the midline? No. Exactly in the midline is the third ventricle, right? So again, foramen of Monro are close to midline, but not in the midline. Superior colliculus, they are present where? In the posterior part of the midbrain. So are they midline? No, they are close to midline. Again, they are two in number, pair of superior colliculus, right? So looking at these options, obviously cerebral aqueduct is the one which is exactly in the midline, and as the size is very small, presence of the cerebral aqueduct or aqueduct of Sylvius in any MRI would indicate that this slide, this section is very close to the midline, right? Answer is option number A over. I hope you got the point. 74-year-old brought to the emergency after being found in his garage in a state of confusion. CT shows an infarct involving much of the superior frontal gyrus. CT done, infarct within the superior frontal gyrus. Infarction, pathology. Which of the following vessels is most likely occluded in this patient? CT done, infarction in the superior frontal gyrus. Obviously, infarction is due to a blockage of a vessel. Which vessel? So which vessel supplies superior frontal gyrus? That is the question. Options are A, B, C, and D. So if you look again at the brain over here, this area is the superior frontal gyrus, right? This whole superolateral surface is basically supplied by the vessels which are coming from the lateral sulcus. These are branches of middle cerebral artery, M4 branches of middle cerebral artery. But this area, this patch over here is supplied by vessels which are coming from the medial surface. And those are the anterior cerebral artery branches which will go over the corpus callosum and they will reach the margin and they will supply the superior frontal gyrus. So those vessels will be coming like this from the medial surface. What I said, they will go over the corpus callosum, they will cross the margin and come over here. So if you look at the options, go over the corpus callosum and marginal, this is the answer. Calloso-marginal artery. It's a branch of anterior cerebral artery. That is the answer over. Angular artery. Now, if we look over here again, what we said the 2-3 questions back, angular gyrus is present over here in the parietal lobe. So this angular gyrus is over here. Suppose angular A for angular gyrus. It will be supplied by which artery? MCA. So the angular artery will be a branch of the MCA. Therefore, angular artery over here, it's a branch of MCA, middle cerebral artery. Lenticulostriate. Again, lenticular means a part of the basal nuclei. Lentiform nucleus. Striate refers to caudate and putamen both. These are again basically branches of MC only, though some ACA, some anterior cerebral artery may give them branches, but they will not come and supply the superior frontal gyrus. And middle cerebral artery, M4 segments already we discussed, they supply the lateral surface. So going through the options, answer over here is calloso-marginal artery. Remember, it's a branch of anterior cerebral artery, right? Let us see next one. 69-year-old lady is brought to the emergency. The daughter reports that her mother suddenly seemed to be unable to speak. The examination reveals that the woman has a non-fluent aphasia. Aphasia is very commonly asked question in our all the exams. Non-fluent aphasia. Non-fluent means obviously there's fluency loss. So it looks like a motor or sensory aphasia. The word non-fluent tells us it is a loss of fluency, motor aphasia. So we have over here the motor aphasia. They're asking you that if you take an MRI, which gyrus will be involved? So we all know that motor aphasia is due to the disturbance or due to the abnormality in the Broca's. Where is the Broca's area located? In the inferior frontal gyrus. Therefore, if you look over here, answer B or option B would be the answer, inferior frontal gyrus. Remember over here, the aphasias are seen only when the involvement is of the dominant hemisphere, which in most of the cases is of the left side. So left side is dominant in most of the cases. So it is a non-fluent aphasia, Broca's aphasia, Broca's area, Brodmann number 44, 45, and inferior frontal gyrus is the location. Over here, remember, the Wernicke's area, the sensory area for the speech, It is present in the superior temporal gyrus, area number 22, right? So Wernicke's STG, superior temporal gyrus, area number 22, right? That is for the sensory fascia. This will be fluent fascia. Let us see another. Which cranial nerve contains the afferent and efferent limbs of corneal reflex? Corneal reflex, if you touch the conjunctiva or a cornea with a wisp of cotton, suddenly you close your eyes like this, or the eyelids like this. Therefore, when you touch the cornea conjunctiva, the afferent is taken up by the sensory nerve supply of the eye. What is the sensory nerve supply of the eye? It is the ophthalmic division of trigeminal. And when you're closing the eyelids shut like this, you are using the orbicularis oculi. And which nerve supplies the muscles of the face, including the orbicularis oculi? The facial nerve. So the efferent should be the facial nerve. Let us see if any one of them is the options. I hope we can see option number C. 5th and 7th are the afferent and efferent limbs of the corneal reflex. Right? I suppose we did similar sort of question yesterday also regarding head. Actually, one more. A 39-year-old lady complains of weakness in her right lower extremity. Weakness where? In the right lower limb. Right lower limb. History suggests that this deficit has developed slowly, perhaps over several years. But you see, the young lady, 39-year-old, not a very old one. MRI shows a meningioma imposing on the cerebral cortex. Slowly growing meningioma. Which of the following gyrus is most likely involved in this patient? So there is a meningioma. Meningioma means tumor of the meninges. Meninges cover the brain. There is a slowly developing or slowly growing meningioma, which is somewhere compressing the cerebral cortex. And the signs symptoms by the patient are weakness in the right lower limb. So weakness meaning by it has to be some motor area, right, in the cerebral cortex. What is the motor in the cerebral cortex? If we just try to draw it once more, right, the lateral sulcus over here, the anterior, the precentral gyrus is the motor area. So somewhere involvement over here. Now we have seen the homunculus, head and neck over here, trunk and upper limb over here, and the lower limbs are going onto the medial surface. And that on the medial surface are known as the paracentral gyrus. Look on the medial surface as well. These are this area on the medial surface are known as paracentral gyrus. Central over here refers to the central sulcus. So the anterior paracentral will be for the motor. Which part of the body? Lower limb. The posterior paracentral gyrus on the medial surface will be for the sensory area. Which part of the body? Lower limb. Here the problem of the patient was the motor, the weakness over here. This weakness is motor. It has to be some anterior paracentral. That should be the answer here. So sometimes sometimes the questions are like this, that you should know the answer while reading the question, then you should search the answer. Sometimes it's like that you try to rule out other options, then some questions are like this should give you happiness when you are searching the answer in the 4 options. You're confident that this should be the answer. Right? Okay, so one more. Which cranial nerve passes between the posterior cerebral artery and the superior cerebellar artery? So we have this vertebral arteries, 2 vertebral arteries entering via the magnum. Basilar artery divides into 2 posterior cerebral arteries. What are these? Posterior cerebral. And just before them, you have a smaller one, superior cerebellar artery. Superior cerebellar artery, this one. Now this area over here is the area for the midbrain. Remember, midbrain is supplied by posterior cerebral artery. Before this basilar artery is the area for the pons, the vertebral artery is the area for the medulla oblongata. So now we are dealing with the area on the midbrain. So there should be a nerve which should come out of the midbrain. That could have been the best possible answer. What are the nerves coming out of the midbrain? Anteriorly is 3rd nerve only. 4th nerve comes from the posterior aspect of the midbrain. Then it comes anteriorly. 3rd and 4th. So 3rd nerve you will find it over here. And the 4th nerve, very thin nerve, comes from behind. So 3rd and 4th nerve are the ones. Let us see. Abducens 6, oculomotor, perfect answer, 3rd answer. There is no trochlear over here, no 4th cranial nerve. Answer is our option number B. Clear? This lies between the 3rd and 4th. Therefore, it is also very common. If you remember the circle of Willis, this is the posterior communicating artery, right? PCOM. Junction of posterior communicating with the posterior cerebral is one of the most common locations for development of aneurysms. Therefore, aneurysms at this junction are one of the common reasons for development of compression of the 3rd nerve, oculomotor nerve, leading to all those extraocular muscle palsies and the parasympathetic involvement of the eye and the related structures around the eye, mainly the sphincter pupil and other things. Right? So remember, this is also one of the causes. Aneurysms at the junction of PCOM and PCA can compress the oculomotor nerve, right? So this was the question over here, right? So I hope you enjoyed this small session of the neuroanatomy. Tomorrow we'll come up with another part of the anatomy with some rapid MCQs. Thank you so much and all the best.